So Alzheimer's disease diagnosis is usually based on sort of classical changes on neuropsychological testing, which highlight that the medial temporal lobe is generally affected first, and then the sort of progression of disease affects different cognitive areas spreading across the rest of the brain. The neuropsychology just describes the syndrome that's associated with, or the clinical syndrome that's associated with Alzheimer's disease. And what diagnosis is trying to involve now is the identification of the abnormal proteins that we see in Alzheimer's disease. So whether that be amyloid PET testing, which shows the evidence of increased levels of amyloid within the substance of the brain, or CSF biomarkers in which we see higher levels of hyperphosphorylated tau or lower levels of amyloid. And interestingly as well, sometimes we use the glucose biomarker of FDG PET, which shows us that the metabolism of the brain changes in Alzheimer's disease. But the diagnosis is usually based on the clinical syndrome identified by neuropsychological tests, which is then backed up by the evidence of the abnormal proteins that we see in the condition.